Danny Hugh, great to meet you.
Lovely to meet
Thanks for coming on the show and talking about your company here. So tell us a little bit about it. The company is called SameView.
Yes, so we're SameView. I'm from Sydney, Australia. We operate across Australia and New Zealand. I'm also the father of two children with disabilities. And SameView is an online platform for disability coordination for families like mine. So we help families connect all of their team members together, their professionals, their educators, their support workers. We get them working as a team so that they can achieve their goals faster with less resources, and most importantly for the parents, less effort, less stress.
You guys must have gotten this idea from your own life then, I would think. There's certain things that you just thought they could be done better. What's an example of one of those things?
Well, absolutely. I mean, our youngest son was born with a rare disease, and his team is about 37 different people. And they don't talk to each other.
Different docs and caregivers and...
Different doctors, different therapists.
And
those people just add up, but they never talk to each other. And so it's always on the parents, the caregivers to manage all of that communication. And teamwork is good for achieving any goal in any environment. So the idea was, well, why isn't it in disability care?
I think a lot of people ask themselves, how can we coordinate care better? But they run into the challenge here that nobody's really interested in paying for care coordination. How has the app been able to address care coordination?
Yeah, we try and keep it very low cost. We're also fortunate in Australia that we've got a world-leading national disability insurance scheme for all families now. And we're very focused on just getting that teamwork to work. So without building too much, we just get everyone on the team to have a common view of the family and also a common view of the goals that they're trying to achieve.
Mm-hmm. What's an example of some of the success that you've seen from people having more coordinated care? Is it focused really towards kids with special needs and their family members?
Yeah, so we've started with a focus on young children, because in early intervention you're investing big for lifelong outcomes, and also children with rare diseases because they've got more complex teams. And by far our biggest and most proudest achievement from 2019 was that we saw a case of a young child achieving a developmental goal faster with the help of SameView. And that's simply by giving their family and their team just better connectivity to each other, being able to talk to each other more often and work together.
That's great. So I would think there's a lot of resources out there, not enough, but still there are a lot. How do you find out when you've got a child with special needs? How do you find out about all the different services and programs and experiences and
That's such a great point. And there is a lot out there, and it is extremely difficult to find it. When you come into the world of disability, there's no course. You're just on it. And so we hope that through SameView, with the data that we have, that in the future we'll be able to be there from day one for families and arm them with the data and the insights to help them find the knowledge that they need, find the people that they need to achieve the goals that they want to achieve.
What were you doing before this company?
Yeah, so I'm an electrical engineer, and I used to work in emergency management, so managing disaster type situations, and that's really where the idea came from. My wife and I discussed why is it that professionally at work I can get a multidisciplinary team to work together towards common goals, but in our personal life we didn't have that with our son.
That's great. If you had to identify a moonshot for 2020, what would you say that is?
A moonshot for 2020. I mean, for us, it's all about children's health. It's about making that as effective as possible for families. And for us, I guess our focus in children's health is in bringing that confidence to all of the caregivers.
That's great. Eric, keep up the great work. It's great to learn about SameView, and if you know of anybody that has children with special needs or disabilities, this sounds like something that's worth looking into. It's called SameView. Good luck to you in your work.
Thank you so much.
Great.